Hi, everybody. This is Dr. Eliana Aaron, Director of EMA-Care. I hope everyone is doing well and taking care of themselves. Today, I want to talk about a few things. There's been a lot of controversy regarding the grand opening of all of the stores and all those other things that have happened in Israel over the last week. In an ideal situation, things should have been opened in a slow, progressive way, which would have led to a way for people in the Ministry of Health to measure what the effect of each change is. What has happened is, unfortunately, in my opinion, is that there's been a lot of political pressure to reopen the markets now that the numbers have been down in Israel. And the problem with that is, number one, the Ministry of Health, although their stamp is symbolically on some of these openings, and some of them were recommended by the Ministry of Health initially, what's been happening since is that each type of vendor, each type of store has been lobbying to get permission to open as well. This has not necessarily been with the blessing of the Ministry of Health or the epidemiologists, because we have not yet measured what that first opening a week ago has actually done. We won't know that until next week, because it takes 2 weeks before we see the impact. And we made one opening on Sunday, and then 2 days later more openings, and Thursday we had more, and today we had more. And it's moving very, very quickly, and not in a way where it's going to be easily measurable until, God forbid, we have another breakout or outbreak or bump, as somebody once taught me. It's called little bumps on the way up. So here's my advice about this. I've been getting a lot of questions from people, can we do this and can we do that? And there are two different answers. Sometimes the answer is yes, you can, but it's not a smart thing to do. So in this day and age, yes, our curve is flattened. Yes, the number of people who got it, who were diagnosed today, who are people who were tested 5 days ago before any of this actually started happening with the opening up post-Passover. And what we saw today is something very nice, which is I'm very happy about, is that we've had our lowest number of new cases since March 18th. I'm not including, there's one Shabbos where they undercounted on a Friday and overcounted a different day. But basically since March 18th, that's 39 days ago. That's what I want to see. I want to see that go sharply down. And the problem is that it's nice to want to get your hair cut. It's nice to want to go out and do things and feel normal, but you have to ask yourself, do I need that? There's still a pandemic out there. Is this really important? Is it worth risking my health? And I don't think it's time to start saying, oh, let's go furniture shopping and let's go to IKEA. I think that that's probably one of the dumber things that has happened here. IKEA is a crowded store. The pictures from inside show clearly no social distancing at all. The purpose of IKEA is to touch and feel the different pieces of furniture and items that they're selling. So I don't know how that makes any sense to tell people that they can go there, but political pressure is what it is. So my advice is be smart and don't just be right. And I think that's really even more important. So I'm gonna stop with that. Another thing that's very clear from studies that have come out, and I've said this before, but I'm gonna say it again, there is absolutely no evidence that getting coronavirus provides any kind of long-term immunity. And actually, there's a very interesting study that I want to share with you about that. An interesting fact is that there are two other coronavirus epidemics or even pandemics that have happened in the past that we have identified. The first one is SARS. SARS was 2002 to 2004. And that was actually considered, if I'm not mistaken, that was considered a pandemic. But what's interesting is that this coronavirus, SARS, from 2002 to 4, only provided immunity on average for 2 years, and all immunity was gone within 6 years, according to a study that came out of Hong Kong. Another coronavirus was MERS, which is the Middle East Respiratory Syndrome, which is another coronavirus. That one caused a lot of cases. That was not a pandemic, it was just an epidemic, and it was localized in the Middle East. And that provided immunity for 18 months. So coronaviruses don't seem to impart a long-term immunity from what we've seen from the 2 other major outbreaks of coronaviruses that I've had. Of course, this coronavirus is much bigger and is affecting a much wider population in the world. It's affecting every country. So the implications of this are that this herd immunity concept is pretty much a moot point from what we're seeing, that people are getting it again and that they're not going to retain immunity. So really only a vaccine is going to get us out of this mess. Okay, so that means we have to figure out how to adapt in the next year, year and a half, until we're able to get the vaccine. And it's doable. It's doable. So an infectious disease expert with the Infectious Diseases Society of America said, first of all, that the second wave of coronavirus is most likely going to be worse than the first, and the CDC said the same thing. One of the problems is that the flu season is exactly the same as the coronavirus season, and that means, and they're the same symptoms for the most part. Many of the symptoms are exactly the same, so very hard to differentiate. They transmit the same way also. I mean, we know coronavirus is more contagious than the flu. The advantage of the flu is that you get sick within a day or so, so you know you're sick right away. Problem is there's no cure for either one. The flu we could mitigate with a vaccine, so of course it's highly recommended that everyone get a flu vaccine, so at least we know if you get flu symptoms, it's not likely to be the flu. Now she believes, Dr. Culler believes, that it's most likely to hit harder in areas that were less affected now by this wave going on in the United States, where there's more susceptible people and there's more of a possibility for transmitting it. Of course, the seasonal flu for this upcoming year also hasn't hit anywhere, so that could also be an issue. And she believes that it could be that the sweet spot for that virus is October to May, peaking early. That's what she believes based on the information she has available from the Infectious Disease Society. So that means we would have a peak earlier in the fall winter and then a slow decline. So as far as how that would look, that means that when a month into the eastern seaboard fall, you would have a lot of cases going on. And what that's going to mean for international travel and how it's going to spread to other countries, we really don't have a way to predict. We can only see for Israel that Israel does close their borders early. They put up restrictions early before we have cases. The fall in Israel is delayed. We don't know how this is going to impact us when those things come into play. So far as we know, Israel's doing very well so far. We hope it stays that way. So now I'm going to get into the third item for today, which was vaccines. So in the month of March, people didn't want to go to doctors, didn't want to go to clinics, and children have not been getting their vaccines as a result. So there's a 30% decrease in children getting vaccines in Israel. And this is a problem because not vaccinating children on time means there's more risk of other, even worse infections going on. We just got past a big measles epidemic in Israel and in Jewish communities around the world. And the reason why we had a measles epidemic is because of poor vaccination rates. So All we don't need, the last thing we need right now is another outbreak of another disease, and measles is much more contagious than coronavirus, and it is a vaccine preventable disease. Coronavirus is not a vaccine preventable disease at this point. So we have to find a solution for getting people vaccinated. And I think it's important for people who are planning to send their kids next year to realize that it is very likely that vaccines will be mandatory. A full vaccine series will be mandatory for gap year students in order to come, because frankly, Israel doesn't want to import disease. And a lot of the times when there are outbreaks in vulnerable populations, they're imported. So keep that in mind, especially including flu. So kids that come here need to plan to get the flu shot when they're here. And when we get closer to that, we will tell you where to get it. I'm going to talk about one more thing real quick, which is a new chart that I sent out yesterday. And I'm going to talk about the differences between these two charts. So I'm going to go ahead and share my screen so you can see what we're talking about here. And we're talking about a chart for death per 1 million population. So this chart over here, the case fatality rate, this chart I've been sending out for a while. That's a classic epidemiological chart. So when you look at, sorry, it's a little bit messed up. I'll try to fix that. When you look at a typical disease like, let's talk about measles, for example, or the flu, then a case fatality rate is very easy to determine because we know all the cases. You can't get measles without having symptoms. You don't get the flu without having symptoms. So it's very easy to understand that we capture all of the people who are sick, and then we're able to accurately calculate the fatalities of the people who got sick. Now, if we go by that statistic, and that's an if, you can see here where the developed world is in terms of equal or more cases to Israel. Israel is by far the safest and most protected country, let's say, for this particular disease. The average in the world is 6.92, and we can see here that Israel is 1.29. The problem with this is that it's not capturing all those people who have the disease but haven't been diagnosed because of not enough testing, because we don't know they're sick, because they may have mild symptoms, and a lot of countries are not capturing all of their cases. As a matter of fact, no countries are capturing all their cases. So when we go back up to deaths per 1 million, why does that become more accurate? Deaths per 1 million eliminates the factor of how much are you testing and focuses on how well are you able to handle the people who are dying and sick from this disease. What's their survivability? So what we're doing is by doing it per million, you take all of the countries, no matter how big or small, and you put them all into the same category. So everyone's being categorized through the same exact number, which is 1 million. Okay, so you look at how many people are dying of coronavirus per 1 million in any given population. And a lot of the countries here have similar populations to Israel. Okay, Ireland is a smaller country. Netherlands, not much bigger. Sweden, Switzerland, a lot of these countries have populations that are not dissimilar to Israel. And what you can see here very clearly is, well, you can see, this does not include any developing countries, and it does not include countries that are not reporting accurately at all. I'm talking about China and Russia, and countries that are extremely poor and really cannot even grasp the testing situation. We are not including those. So like Peru is not on here, for example. Peru is a very, very poor country. So of these developed countries who have funds for the most part, and they can test, is you can see very clearly that Israel has the lowest deaths per 1 million population, and this is for every developed country with similar or same population with coronavirus as Israel. The exception is Iran, but Iran does have good testing capabilities, so I left them in. So I wanted to explain why this was also important. We look at all these numbers because, again, this is a very much in flux situation. And what we see is that it's important to see this from different angles. So as things develop, we start thinking of new ways to look at it. All of the numbers that we look at show that Israel is the safest country to be in. I want to give comfort to people who are living here. I hope that we do not have a bump next week after 2 weeks after these regulations have go up. And I hope people are starting to keep, not starting to, but continuing to keep to the regulations, wearing a mask in public, keeping social distancing and excellent hygiene. And in that way, as the summer comes upon us, we will be able to go back to a good sense of normalcy. We are already starting to. And slowly but surely, we will get through this phase of the disease, and we will be much better prepared, hopefully, for the second wave. I hope everyone stays well, stays healthy, and please stay home if you can. Thank you.